Hi, my name is Dr. SACHIN TRIVEDI. I'm Director of Medical Oncology in Mumbai. Before I came back to India, I was the Head of Oncology Services at Nottingham University in the UK. Now, today we are witnessing an amazing academic feast in form of the Best of ESMO Conference. So what Best of ESMO is, it is actually a filtration of all the latest update from the ESMO Conference, which is organized annually in one of the European cities. So what happens here is researchers and clinicians and trialists from all over the world gather. There are thousands of them that they present the article, and out of these thousands of articles, we filter out the best articles and the best data that is relevant to our Indian practice. So I decided to do this first licensed conference for ESMO in India is happening here, by the way. So this is one of that wonderful opportunity where all of us clinicians from across the country have gathered together to filter out these articles and discuss and debate whether these articles and this data makes a difference to the lives of a patient. And what we have found so far is that some of this data is so amazing. We have also discussed some data from Indian organizations also, such as, having lower dose of expensive treatment can be as effective as a higher dose of treatment. So this is really amazing.
Doc, what makes Best of ESMO an important platform for all the oncologists?
Say, oncologists saddle in two different boats, or they live in two different worlds. On one side, we are social workers, psychologists, and clinicians. But on the other side, one of our forte is also in clinical trials and research. So most of us in some shape or form are scientists. So what we do is we have to find new drugs and new strategies to treat our patients and to improve their lives. So ESMO is European Society of Medical Oncology. There are thousands of delegates across and thousands of members across the world. It is headquartered in Switzerland. Once a year, they create a platform where all of us can gather and present all the thousands of data. Some of this is negative, some of this is positive, but every year there is a selection of, set of research papers and data that tell us that from now on the treatment of certain type of cancer has changed because we have found either a new strategy or new drug. So when this happens, these papers are filtered out and these are discussed and debated in different places, and one of them today, this time what we're doing is in India to see how the data will help us plan treatment and design treatment so that we can cure cancer patients in India and manage cancer patients in India in a much better way.
What would be that one key takeaway that you want everyone to take away from this event?
So one key takeaway is collaboration, cooperation, and knowledge. So knowledge is power. So if you collaborate and cooperate and generate knowledge, it gives you the power to actually change lives of patients and help thousands of cancer patients who are diagnosed unfortunately in India with this deadly disease.
How relevant are these global oncology updates for Indian?
So it's a very interesting question, and that is exactly what I was trying to answer. See, entire humanity we believe is one, but there are subtle differences in the way we are made in terms of our response to treatment, and the way our biology works, the way our metabolism works, and there are some data that may be relevant to the Japanese population, some data may be relevant to the American population, but through these articles and through these meetings, what we try to find out is what are the most relevant data and article for Indian patients that will allow us to immediately change the lives of our patients in India. So it is not just an academic interest, it is also the interest of actually making a clinically meaningful difference to our patients' treatment and their lives.
Doc, why are discussions like this crucial for improving patient care?
Yeah, like we just discussed. See, if you look at, the number of articles that are being published in cancer research, it is literally like reading a newspaper every day. So every day, thousands of articles are published and thousands of, gigabytes of new information is available for us to interpret. It is not humanly possible to do all of that on a running basis. So we gather together, now and then in meetings and conferences in such a way that we can actually filter out this information and help our patients accordingly.
In one word, how would you describe today's event?
Inspiring and amazing.
Thank you, Doc.
Thank you.